Good morning.
Good morning. Thank you for being back.
Can everybody see? Can everybody see and hear?
We sure can. Absolutely perfectly. Thank you, Dr.
Wow.
Miracles never cease. Oh, delightful. I was with Steve and his team last evening at the panel, and it's so nice to be with you again today. Now we've got a few minutes to really see if we can't really completely eliminate cardiovascular disease. So let's see if we can't get started. Anne, I just want to be sure we clear the air with this, so you know that there are no financial conflicts. Now, I should share with you that about 10 years ago, I wrote an editorial for the American Journal of Cardiology that was entitled, "Is the Present Therapy for Coronary Artery Disease the Radical Mastectomy of the 21st Century?" Now, what did I mean by that? You know, it was actually in 1882 that William Halsted from Johns Hopkins devised the radical mastectomy. And that was an operation that removed not only the breast, all the skin over the breast, all the muscles under the breast, a radical lymph node dissection. It was disfiguring and painful. And many women preferred to simply watch the lump in the breast rather than have the radical mastectomy. And sadly, because Halsted was such a towering figure and he had such influence, and many of his residents became chairmen of surgical departments, that the radical mastectomy became a standardized surgical error for over 70 years, when at that time, there were courageous young surgeons who said, wait a minute, we think we can get equal results with much lesser procedures. And I wondered if that isn't really the same way it is in cardiovascular medicine today. When you think back, it was actually 40 years ago that we established stents and bypasses and a host of medications. And what have we done in the last 40 years? 40 years ago, cardiovascular disease was the leading cause of death of women and men in the United States. And today, it is still the #1 cause of death of women and men in the United States. And we really have to ask ourselves, is that the best that we can be? Because isn't this a sort of a standardized error when we haven't made any progress in 40 years? And we really have to look very carefully, because what you see on the slide in front of you is just an example of a number of cultures on the planet Earth where cardiovascular disease is virtually non-existent. And why? Because they thrive on whole food, plant-based nutrition, essentially without oil. If you were a cardiac surgeon and you decided that you were going to take your shingle and hang it out in Okinawa or rural China, the Papua Highlands, Central Africa, the Tarahumara in northern Mexico, forget it. You better plan on selling pencils. Why? They don't have cardiovascular disease for the reasons that we just discussed. So we really have to figure out a way to do a lot better. And so today, we're going to try to look at how that is something that we can do. Now, this is the oldest slide in my presentation. And I took this slide in 1968 when I was leaving Vietnam, having spent a year there as a combat surgeon. And this slide reminds me to tell the audience that if we autopsy our young GIs who have died in combat, roughly 80% of those average 20-year-olds will find out they already have evidence of coronary artery disease that they can see without a microscope. Not enough for their cardiac events yet, but nevertheless, here they are at that young age, already with early coronary disease. So that study was then repeated 45 years later by a group called the atherosclerosis in the young. And this was a study of men and women between the ages of 17 and 34, who had died of accidents, homicides, and suicides. Now, coronary artery disease in this young group is ubiquitous. Everybody. Again, not enough to have your cardiac events yet, but there it is, the disease at that young age already starting. So it's little surprise for a disease that begins to get its foundation in our late teenage years. It's no great surprise that by the time we hit our 40s and 50s, we begin to see this absolute tsunami of cardiovascular disease. Now, here is where we had a chance to really get it right. World War II. In World War II, it was characteristic that the Axis powers of Germany overran the Low Countries of Western Europe, of Holland and Belgium. They occupied Denmark and Norway. And it was characteristic that the Germans took away their livestock for their troops. So their cattle, their sheep, their goats, their pigs, their chickens, their turkeys were gone. Now suddenly, these Western European nations were plant-based. And it was interesting that in 1951, Dr. Strom and Janssen, reporting in England's leading medical journal, The Lancet, they looked at the deaths from heart attack and stroke in Norway during this time period. So let's do this together. On this next slide, I want to have us focus first here on the lower left, where you can see in Norway in 1927, the deaths from heart attack and stroke were going up. By 1930, they were still going up. 1935, going up. 1939, in come the Germans. Whoop, 1940. Whoop, 41. This sudden plunging of deaths. Who knew these Germans were these great public health educators? But look what happened in 1945 with the death of Adolf Hitler, the cessation of hostilities in the European theater. Once again, back comes the meat, back comes the dairy. Suddenly back come the strokes and back come the heart attacks. But sadly, we just didn't get it right. Now, obviously what you're seeing here are two blood vessels, one normal and the other on your right obviously is seriously diseased. That amount of disease has taken decades to form. Inside that disease is muscle, cholesterol, calcium, and really a lot of inflammation. And you're probably saying, you know, when that small opening finally closes, there's going to be a heart attack. Well, interestingly enough, probably not. Only about 10% of heart attacks come from something which is this nasty. Oh, yes. No question, this patient's probably going to have angina, chest pain. It's going to have also shortness of breath. But heart attack, not so much. Why? Because this has taken so long to form that the body itself has started to make its own bypass. That is to say, not infrequently, when you do an angiogram and you're looking at the blood vessels to the heart, you can see that one of the three major arteries may be completely 100% closed off, and yet the patient will not have had a heart attack. Why? Because as the downstream heart muscle has been slowly deprived of its oxygen and nutrients, it begins to build these tiny little threads of what we call collaterals that go around that blockage and will nourish the downstream heart muscle, which is being deprived of its usual amount of blood supply. And what happens is, therefore, the amount of that blood supply through the body's own bypass is enough to sustain the downstream heart muscle viability, that even when the thing that is the blood vessel finally closes off, there'll still be enough blood so that that downstream heart muscle will not die. But I want to have you focus now on the artery on the left, the normal one. And the key here for you to take away is the name of that delicate innermost lining that hopefully those of you, even in the back of the room, that delicate innermost lining has a name. It's called the endothelium. And each individual cell is an endothelial cell. And that is probably now the most important group of molecules that we're going to be discussing today. If you get nothing else from this presentation, there are two words I want you to take home. One is the endothelium, and the two we're about to hear from in a moment. But what seems to happen, if you will look here on the figure on the left, when you are eating the cheeseburger, the milkshake, the pizza, the first thing that starts to happen in your bloodstream is those cellular elements begin to get sticky, sticky, sticky. Your endothelial cells get sticky. Your platelets, your clotting factor gets sticky. Your white blood cells get sticky. Your LDL cholesterol gets sticky. But now, here is a slide that I've borrowed from Peter Libby of Harvard. Yes, I know some of you know that I went to Yale, but that's fine. Yale man always had a great admiration for Harvard. Now let's make some sense out of this. First, the blue area you're looking at is the flowing blood. And if we together go over to the far left upper hand corner there, you will see those orange molecules are the LDL cholesterol in the bloodstream. And the blood in the blue is separated from the artery wall by those single little purple cells going across. Those are the endothelial cells. Let's go back to the upper left. Those orange LDL cholesterol particles are now sticky. They bump up against the sticky endothelium and they find a crack or fissure or an opening, and they migrate into the subendothelial space where they do not belong. And that when that happens, they become oxidized. So Peter Libby from Harvard here has now changed the color of the LDL cholesterol from orange to yellow to indicate that these are now a small, hard, dense, oxidized LDL particle. And inasmuch as the subendothelial space does not like this, it calls upon the SWAT team, which are usually our white blood cells, but Peter Libby from Harvard has painted them here blue in honor of Yale, and we like that. But let's follow that. You can see the SWAT team is coming across as this blue molecule, and it is now doing its job of gobbling up like Pac-Man as it goes from left to right, gobbling up all those small, hard, dense LDL particles until we get all the way over here to the right, where that macrophage or that SWAT particle is now completely chock full of these small, hard, dense, oxidized LDL particles. And that is when we in medicine do what we do so often. We change the name. It is now called the foam cell. And the foam cell is truly the Darth Vader of this sequence of events. Why? Because the foam cell manufactures these nasty, nasty substances we call metalloproteinases, such as tromelacin, elastase, collagenase, myeloperoxidase. What do they do that's so bad? The metalloproteinases progressively will erode. Let's look at the figure on the left here. You can see the cap over this plaque, especially at its upper portion. It has been eroded and it's gotten thinner and thinner and thinner, so that now the sheer force of rushing blood over that thinned out cap tears it. And this is an absolute seminal moment. You have now ruptured your plaque. Once you have ruptured your plaque, This allows the material inside the plaque to extravasate, or ooze out, if you will, into the flowing blood. Whereupon we can now go to figure number B in the middle, because that extravasation of plaque content has activated our clotting factors like platelets. And you can see in the middle figure, a clot begins to form. Now, the clot is in and of itself self-propagating. So in a matter of further minutes, we go from B all the way over to the figure on the right, C. And now look, the clot is completely blocking all the artery. Suddenly, with no time for collaterals to develop, all the downstream heart muscle is immediately deprived of all its blood supply with oxygen and nutrients. It starts to die. And that, ladies and gentlemen, is 90% of how heart attacks form. Now, if I do my job with you correctly today, every one of you, and hopefully your friends and relatives, can become heart attack proof. All right. How are you going to do that? Well, we're not going to do it with another drug or a pill. We're not going to do it with a stent or a bypass. But we are going to do it by changing your biochemistry. How are we going to change your biochemistry? By whole food, plant-based nutrition. When that happens and we change your biochemistry, this entire sequence of events that I've just described for you will be eliminated. You will not have your cellular elements in your bloodstream get sticky when you're eating plant-based food. You will not have a migration of your LDL cholesterol into the subendothelial space. You will not have the arrival of the SWAT team. You will not have the development of the foam cell. And if there is no foam cell, then you're not going to be shrinking the cap over your plaque. And if the cap over your plaque does not weaken and it becomes stronger and it cannot rupture, if you cannot rupture the cap over your plaque, you have made yourself heart attack proof. How long should that take? We think about 3 weeks, and I'll try to show you how that's arrived at. Now, forget the x-ray on this slide, but I want you to focus on what the artist has drawn here, with an artery where it's half filled with plaque, and the other half is open. And you can see in the open half, the innermost lining of those pronounced cells, those white cells, that's the endothelial cell. Now, the endothelial cell has an interesting history. Up until 1980, we in medicine used to think of the endothelial cell as nothing more than sort of a cute red brick that was lining these wonderful vascular pipes of ours, covering, believe it or not, covering about 8 tennis courts, if you spread them all out thin, but 60,000 miles. Pretty important structure. But that idea that it was just sort of a red brick lining our pipes stopped in 1980, when at this point, Dr. Furchtgott, working in Brooklyn, was taking the largest blood vessel from a rodent, the aorta. And he would do this sort of elliptical spiral staircase cut on it right through the endothelium, immerse it in saline, and it would constrict. But one day, Dr. Furchtgott did not do the cut on the aorta, no injury to the endothelium, and immersed it, and it would dilate. Did it again with another, dilate. So now suddenly, the race was on globally. What was the EDRF that Dr. Furchtgott had discovered? Endothelial derived relaxation factor. Kind of rolls right off your tongue. Fortunately, that term was with us only 8 years, because at the end of 8 years, Dr. Furchtgott Dr. Murad, Dr. Luignaro discovered that the EDRF was indeed a gas, nitric oxide. That's the second word that I want you to embrace today. Now, those three men in 1998 received the Nobel Prize for discovery of nitric oxide. Now, what is it about nitric oxide that makes it worthy of a Nobel Prize? What are its functions? Its functions are the salvation and the protection of all of our blood vessels. For example, nitric oxide will keep all those cellular elements within our bloodstream flowing smoothly like Teflon rather than Velcro. Keeps things from getting sticky. Number two, nitric oxide is the strongest blood vessel dilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate. That's nitric oxide. Number three, nitric oxide will protect the wall of the artery from becoming thickened, stiff, or inflamed. Protect us from getting high blood pressure or hypertension. Number four. Now, number four is the absolute key. A safe and normal amount of nitric oxide will protect us all from ever developing any blockages or plaque. So literally, if that's the case, everybody on the planet Earth who has cardiovascular disease has their disease because by now, in the previous decades, they have so significantly trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages and plaque. However, the good news is this. This is not a malignancy. This is a completely benign foodborne illness. And once you can get persons to understand that never, never, ever again are they to pass through their lips a single morsel that is going to further injure their endothelial production of nitric oxide, then the endothelium begins to recover, will make enough nitric oxide so we can not only halt disease progression, but we often see significant elements of disease reversal. Now, the other thing that I think is important is probably right now, a number of you are saying, I wonder what my level of nitric oxide is. Well, how does that get measured? Well, we really don't have a good method in our office yet, but I want to share with you how it's done on a research basis. If you take an ultrasound probe and place it over your brachial artery at your elbow, there is the readout on the screen of that diameter of your brachial artery. Then, for 5 minutes, you encircle your upper arm with a blood pressure cuff that you inflate to above systolic blood pressure so that for 5 minutes, you have absolutely zero blood flow to your forearm and hand. Yes, I've had that done. It's not exactly habit forming. But then you release the cuff and immediately take the ultrasound probe and again remeasure the new diameter of the brachial artery. And in the normal individual, it'll be 30% greater because of all the outpouring of that wonderful nitric oxide from when the tourniquet is on. All right. Now, the next great thing that happened with nitric oxide was when Dr. Vogel, Robert Vogel, was chairman of cardiology at the University of Maryland, when he took a group of healthy young subjects to a certain fast food restaurant that was characterized by arches which are golden. Half of them got the cornflakes, their brachial artery tourniquet test, normal. Now the other half had the hash browns and sausage. And within 120 minutes of eating that meal, with the brachial artery tourniquet test, they could not dilate the artery. That single meal had so sufficiently trashed, injured, compromised, and turned that endothelial system into a train wreck that they couldn't dilate the artery. However, being young, as they followed them into the late afternoon, early evening, they began to recover. And yet, you and I know that the next morning for breakfast, it's going to be scrambled eggs and bacon. Lunchtime, it'll probably be white bread with cold cuts and mayonnaise. And then at supper time, we'll have baked potato with sour cream, lamb chops, vegetables soaked in butter, ranch dressing on a salad, and ice cream for dessert. Here in the good old USA, starting as kids, youngsters, we just take those endothelial cells and we crush them and we beat them and we destroy them. And it's no great mystery why it is that we have such an epidemic of cardiovascular disease. Now, this happens to be just a little slide I borrowed from the Mayo Clinic, and it just sort of summarizes a lot of the bodily dysfunctions that occur when we have endothelial injury and problems, such as sleep apnea, periodontitis, metabolic syndrome, osteoporosis, erectile dysfunction, cerebral vascular disease, dementia, coronary heart disease, heart failure, sudden death, atrial fibrillation, atrial thrombosis, renal failure, claudication, and venous thrombosis. Quite a list of items there. Now, I want to summarize just with you briefly what the functions are that we've just discussed that are so really magical about nitric oxide. It is not nitrous oxide, it is nitric oxide. Prevents the stickiness in our cellular elements in the bloodstream. Strongest vasodilator, avoids arterial thickening, prevents blockages, prevents smooth muscle migration into the wall of the artery, and it can destroy Darth Vader, the foam cell. Now, although if we had time, we would discuss all four of these absolutely magical defense mechanisms that the body has, but we are going to discuss the endothelial cell. But I want you to know that the other three, the endothelial progenitor cell, the HDL cholesterol, and the dimethyl arginine dimethylaminohydrolase, all of those, all four are going to be absolutely optimized when you are eating whole food plant-based nutrition. Well, let's take a moment now and see if we can't actually get where the rubber hits the road and look at perhaps a study. And I probably should give you a little bit of background here because you're probably wondering, what in the world is a general surgeon doing with an interest in cardiovascular disease? So I should share with you a bit of background. When I joined the Cleveland Clinic after coming back from Vietnam in 1969, by the mid and late 1970s, I was chairman of our breast cancer task force. And it was as chairman of the breast cancer task force that I became increasingly disillusioned with the fact that for no matter how many women I was doing breast surgery, I was absolutely doing nothing whatsoever for the next unsuspecting victim. And this led me to do a bit of a global study. And it was quite striking to find that there were other cultures on the planet where breast cancer rates were 30 and 40 times less frequent than the United States, like, for instance, Kenya. And breast cancer was very infrequently seen in rural Japan in the 1950s. And yet, as soon as the Japanese women moved to the United States, by the second and third generation, they now had the same rate of breast cancer as their Caucasian counterpart. And perhaps even more striking was when you looked at the entire nation of Japan. How many autopsy deaths were there in Japan in the entire nation due to prostate cancer in 1958? The total, 18. The most mind-boggling public health figure I think I've ever encountered. And yet by 1978, 20 years later, the figure was still only 137 as they slowly westernized. But as soon as the Japanese men moved to the United States, now they have the same increased rates of prostate cancer as men in the United States. In this country this year, it's not 18 who will die from prostate cancer. It is 28,000, which is astounding when you think of how strong a correlation there seems to be between nutrition and prostate cancer. Well, somewhere along the line of this global investigation that I was doing, I began to frequently encounter cultures where cardiovascular disease was virtually non-existent. And it just seemed to me that there would be a bigger bang for the buck if we could somehow get people in the United States to eat plant-based. They not only would save themselves from heart disease, but would be markedly diminish the likelihood of having the common Western cancers of breast, prostate, colon, and perhaps pancreatic. So I came back to ground zero with the understanding that just because I had done this sort of global survey, there was nothing, you simply can't say to the United States public at large, hey, you guys, you better eat plant-based and save yourself from heart disease. That doesn't quite fly. You've really got to do the research. So I knew I was going to do this study, but in all honesty, I was a cholesterolholic. I had grown up on an Aberdeen Angus beef farm and a dairy farm, and I loved all those foods. And you probably know that by now, anytime you ask a patient or even asking yourself to make a significant lifestyle change, there are sort of a number of steps you have to go through. You start with pre-contemplation, then you go to contemplation, then you go action, and then you go maintenance. So I was knowing I was going to do this, but I just didn't quite know when I was going to get started. And it happened in April of 1984 was a seminal moment. I was with my wife, Ann, and we were together at a surgical meeting in New Haven, Connecticut. And sadly, the papers were rather dull. The weather was rotten. But they always seemed to have a banquet after these occasions. And at the banquet, a waitress put a plate in front of me, and the roast beef was so enormous, it was draped over the sides of the plate. So as I shook my head, Ann looked at me and said, "You're not going to eat your roast beef?" And I said, "No." She said, "Well, then I'll have it." Now, I should give you a bit of background. Ann's mother had died at age 52 of breast cancer. And 2 weeks after that meeting in New Haven, Ann's sister came down with breast cancer. And she looked at me and said, "I'm with you." So together in April of 1984, we became plant-based. And a year later, I went to Bill Sheldon, who was the chairman of the Department of Cardiology, and said I wanted to do a small study, but it had to be small because of my surgical obligations, which were still intact. And if there could be 25 patients who were seriously ill with cardiovascular disease, I wanted them to try to excuse me. I wanted them to try to eat plant-based. And so my concern was, how was I going to get these people to comply? Because this was really the challenge. And I decided that for these patients, I would use the same mantra that I was using previously for my cancer patients. And it was something that I had learned years ago from a marvelous West Coast surgeon by the name of Bert Dunphy. And Bert used to say that patients with cancer are not afraid to suffer, and patients with cancer are not afraid to die. But patients with cancer are afraid of being abandoned by their family or by their physician. So for the first 5 years of this study, I saw every patient in my office every 2 weeks. We drew their cholesterol, checked their blood pressure, their weight, and I went over every morsel they ate with a diet diary. At the end of 5 years, I got a little bit more courageous, and I stretched it out to once a month, recognizing that most cardiologists see their patients twice a year. Now, by the end of 10 years, they were really pretty well on autopilot, so I extended it out to see them quarterly. And then at 12 years, we wrote this study up and published, and which I'm going to sort of share with you now. It's the first of 2 studies that I was involved in with this. And although there were 23 men and 1 woman, we had nothing against women. It was simply the way that patients were sent to me. In the subsequent study, we had many more women. But the key was this. They were all seriously ill with triple vessel disease. I did not want them to eat a single morsel that would further injure their endothelial cells. So that meant for them to avoid any oil, olive oil, corn oil, soybean oil, safflower oil, sunflower oil, coconut oil, palm oil, oil in a cracker, oil in a piece of bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face. That meant meat, fish, chicken, fowl, turkey, and eggs were gone. Also, no dairy, milk, cream, butter, cheese, ice cream, and yogurt. I didn't like sugary drinks or Pepsi or Coke or sugary foods, cakes, pies, cookies, stevia, agave, excesses of maple syrup, molasses, and honey. Sugar injures endothelial cells. I'd like them to avoid. I didn't have a problem with people who did not have cardiovascular disease having nuts, but my patients who had cardiovascular disease, I wanted them to avoid nuts, peanut butter, nut butters, cashew sauce, or avocado, and finally, avoid coffee with caffeine. Now, we're going to tell you in a moment what they ate, but first, this is so that those of you who may be nervous about what I said about oil, here is a peer-reviewed scientific study showing that olive, soybean, and palm oil intake have a similar acute detrimental effect over the endothelial function in healthy young subjects. Yeah. Now, this actually is a bit of study from our institution by Stanley Hazen, who was looking specifically at the molecules of lecithin and carnitine, which are found in these animal products that are eaten by an omnivore. And what he looked at was that in an omnivore, it appears that in the gut bacteria, in the microbiome, there are bacteria which will metabolize these molecules of lecithin and carnitine into TMA, trimethylamine, which is rapidly oxidized in your liver to trimethylamine oxide. And trimethylamine oxide appears to injure your blood vessels, which is a sort of very powerful statement of why animal foods are injuring your blood vessels. Here is the schematic of what I've just mentioned, namely lecithin and carnitine, the animal molecules that are being metabolized by the omnivore's gut bacteria into TMAO, which gives vascular disease. But the striking thing that was found by Stanley Hazen was that if he took somebody who was absolutely 100% total plant-based and gave them a lamb chop, measured their blood from TMO, none, not there. So tremendous protection against vascular disease by avoiding the injury from TMO, and TMO comes from eating animal products. Now, you probably wonder why I'm showing you, this is the single slide in this entire presentation that has nothing whatsoever to do with cardiovascular disease, because it was to me, it was such a supremely powerful moment in October of 2015, the World Health Organization. Imagine this, the WHO membership from all over the world came together and agreed that red meat now had the same level of carcinogenicity as smoking cigarettes. All right, back to this trust study. What were these patients going to eat? They were going to eat whole grains for their cereal, bread, pasta, rolls, and bagels, 101 different types of legumes, lentils, and beans, and all these marvelous red, yellow, green leafy vegetables, and white potatoes, sweet potatoes, and fruit. Now, one other thing that I think is important at this point to discuss, and that is what we've added in the last decade for patients who do have cardiovascular disease. Hopefully by now, if I've made myself clear, you understand the importance of the endothelial cells and nitric oxide. Now, what is now understood is that the endothelial production of nitric oxide is age dependent. For example, when you look at boys and girls who are 8 or 9 years old, you never heard of them having a heart attack. Why? They have nitric oxide pouring out of their ears. But by the time you're age 50, even if you are beautifully healthy, your endothelial cells are now producing 50% of the nitric oxide that you had when you were 25. By the time you're over 80, you've lost 70% of the nitric oxide production from endothelial cells. So since all these patients with heart disease are so deprived of nitric oxide, I should share with you how we did this business of additionally adding 6 green leafy vegetables daily. Try to have the patients understand that if they could shrink their head to a size that they could crawl inside the coronary artery supplying their heart with blood, they would see that blockage as an absolute cauldron of oxidative inflammation. So we need antioxidants, but no, do not go down to the health food store and buy a jug of pills that says antioxidant, because it doesn't work and it's going to be harmful. I need you to get your antioxidants from food. Fair enough. What food? Food that is high in what we call ORAC value, ORAC, oxygen radical absorptive capacity. So if you're having raspberries, blueberries, strawberries, and blackberries on your morning oat cereal, terrific start. However, nothing is going to trump the antioxidant value of green leafy vegetables. So I need you to chew 6 times a day a green leafy vegetable, roughly half the size of your fist, after it has first been boiled in water or steamed 5.5 to 6 minutes, so it's now nice and tender. And then I'd like to have you be sure to anoint it with several drops of either a rice or balsamic vinegar. Why? Because research has shown us that the acetic acid from those vinegars will restore the nitric oxide synthase enzyme, which is contained within the endothelial cell and responsible for making nitric oxide. All right. Now, therefore, I want you to chew this green leafy vegetable alongside your breakfast, again as a mid-morning snack, again with your lunch and sandwich, that's 3, mid-afternoon, 4, dinner time, 5, and of course I adore it when you have that evening snack of arugula or kale. Now, the second benefit from chewing the green leafy vegetable, It restores the capacity of your bone marrow to once again make the endothelial progenitor cell. What do the endothelial progenitor cells do? They make it and restore, that is, they replace your senescent, injured, worn out endothelial cells. Now, the third benefit from chewing the green leafy vegetable, and this is most important of all, because this is your alternate pathway to make nitric oxide, as your endothelial cells are not doing it as well as you would have liked. So the third benefit is, as you are chewing a green leafy vegetable, you are chewing a green nitrate. As you chew the green nitrate, it is going to mix with the facultative anaerobic bacteria that reside in the crypts and grooves of your tongue. Those bacteria are going to reduce that green nitrate that you are chewing to a green nitrite. Now, when you swallow the nitrite, it is your own gastric acid, which is going to further reduce that nitrite to more nitric oxide, which can enter your nitric oxide pool. So just think about it. How amazing. With no added expense, no hideous side effects. Literally, from morning to night, dawn to dusk, you are absolutely restoring nitric oxide, the very molecule, the deficiency of which gave you this disease in the first place. Now, there is a caveat to this. Toothpaste with fluoride, public drinking water with fluoride, or mouthwash will injure the beneficial bacteria in your mouth. And we do not like patients to take antacids, because antacids will reduce your gastric acidity, and you will not be able to reduce the nitrite to more nitric oxide. Now, you're probably wondering, what are those green leafy vegetables that Dr. Esselstyn is talking about? They are bok choy, Swiss chard, kale, collards, collard green, beet greens, mustard green, turnip greens, napa cabbage, Brussels sprouts, broccoli, cauliflower, cilantro, parsley, spinach, and arugula, and asparagus. And the top 6 are kale, Swiss chard, spinach, arugula, beet greens, and beets. Pretty darn exciting stuff. Oh, no oil. With apologies to Leonardo da Vinci, no oil. Now, back to our study. The question is whether or not you can see this as this is a small an improvement of reversal of artery disease, as you can see. I should share with you that these angiograms that I'm sharing with you now were all reviewed in triplicate in the Cleveland Clinic Angiography Core Laboratory by senior technicians that do this all day long for national medical trials. So when we look at some of these angiograms as follow-up to that original study, when I give you a certain percentage of reversal, I know it's accurate because of this evaluation. This is a 67-year-old retired pediatrician. You are looking at the left anterior descending coronary artery. And from the arrow on the left to the arrow on the right, the increase in improvement was 10%, which is about as small as the naked eye can see. This next one is a 58-year-old factory worker. You're looking at the circumflex artery that goes to the back of the heart. And from the arrow on the left to the arrow on the right, it was described as a 20% improvement. This next is a 54-year-old security guard. This time you're looking at the right coronary artery. And from the arrow on the left to the arrow on the right, the improvement was described as 30%. Now this handsome young fellow, Dr. Crow, is in the first chapter in my book. In 1996, at age 44, Dr. Crow was getting chest pain. He had a cholesterol of 156. He was not overweight. He exercised regularly. He was not diabetic. He was not a smoker. He did not have high blood pressure. So finally, in October of 1996, cardiology worked him up. They could find nothing of significance. A month later, in November, he was finishing his surgical schedule and sat down to write post-operative orders when suddenly he felt the elephant sitting on his chest, pain in his left jaw, shoulder, arm. He was having a heart attack, and he was whipped down to the catheterization laboratory. The catheterization was initiated. He had a cardiac arrest. He was resuscitated. They finished the catheterization with one more cardiac arrest. And then 3 days later, when he was stable, he was discharged. But he was very depressed at the time of discharge because he found that at the time of his angiogram, the entire lower 1/3, bracketed here by this yellow line, this entire lower 1/3 of the left anterior coronary artery disease was all moth-eaten and diseased over too long a segment to just ram in, pound in stent after stent. And it was too far down the artery for bypass. So he was very depressed and felt they weren't able to do much for him. So 2 weeks after his heart attack, Ann and I had Joe and his wife out for dinner. And wait a minute, sorry, here we go. We'll get it right in a moment. There we go. Had him out for dinner, and Joe, I said, look, you've been eating this absolutely horrible Western diet, and you've got the typical Western disease. Why don't you think about going plant-based? We've got 10 years of data. And he looked at me and he said, okay, they really couldn't do much else for me. I'll give it a shot, but I'm not going to take any of those statin drugs. I don't trust them. Too many side effects. I said, fine, that's your call, no problem. He, over the next 2.5 years, he became the absolute personification of commitment to whole food, plant-based nutrition. His total cholesterol plummeted. His LDL cholesterol went from 98 to 38. Then 2.5 years after his heart attack, he had another angiogram. Now, up in the surgical office areas, our doors are 3 doors apart. And so on noontime, on the day on which I knew earlier that morning he had had his follow-up angiogram, I walked over and let myself into his office, and there he was, sitting behind the desk. I said, Joe, I understand you had the follow-up angiogram earlier today. Mind sharing with me, how did it go? And he said, he came around, put his arms around me, said, you know, I think we're doing okay. I said, well, would there be any chance that I could see the angiogram? He said, sure. Now, that was really quite exciting. It was one of the more profound reversals that we've seen. And I think it's important that I share with you the fact that not uncommonly, when the patients are young and the plaque is young and made up of inflammation, fat, and cholesterol, the body can do a pretty amazing job of reversing it. However, when the patients are older and the plaque has been there for decades and it's made up of fibrosis and scar and calcification, it's probably not going to go away completely or very much. But nevertheless, even those patients should be able to get back to full activity of daily living without restriction. And before I let you go today, it's my responsibility to show you how that can happen. Now, this next thing interesting is also a young man, a 45-year-old gentleman from Florida who had a heart attack on July 14th of 2017. And I think if you will follow that arrow, you will see that extremely severely pinched area of this obtuse marginal artery, a branch off the circumflex that goes to the back of the heart. And it was described as being 80% blocked. Now, the patient had other blocked arteries, so that the cardiologist was recommending to him that he have bypass surgery. But he had a book called Prevent and Reverse Heart Disease, and he told the cardiologist he was going to follow that book because they didn't want to have that operation. Well, the cardiologist really remained quite skeptical, and a year later, he had another angiogram of that same area in July of 2018. And now you can see it was no longer 80% blocked, it was now 40% blocked. Well, at this point, the patient switched to a different cardiologist, and the new cardiologist, also a year and a half later, was still curious about what was going on. So he had his third angiogram, and now it was all gone. Now, the lesson that here is really, I think, rather profound. This man absolutely vanquished his disease without the help of a single physician. Now, I happened to find out about this because it was after this final angiogram where the disease was gone that the patient wrote to me and thanked me for writing the book, Prevent and Reverse Heart Disease, and he also sent me these angiograms. But I think there's such a powerful lesson here if we could only get the cardiovascular community to understand it. What possible rationale is there not to permit, or at least offer, the option of whole food plant-based nutrition to every patient with cardiovascular disease, with the opportunity to halt their disease and often see significant elements of disease reversal? I should share with you that it was 5 years ago that I was invited by the American College of Cardiology to become a member and join their nutrition committee. Why? Because the whole thrust of the committee is to try to see if we can educate cardiologists about the causation of the illness that they have been designated to treat. Cardiologists actually are quite good fellows, but they have zero training in medical school, or practically zero in their postgraduate training about nutrition. All right. That simply is a summary of the 3 angiograms I just showed you. They're all in a row, from 80% to 40% to normal. All right. Now, back to this study of that first study. We found that there were 18 patients who stayed with us the entire 12 years. I wanted to know how many coronary events, that is heart attack, stroke, and death, not death, how many coronary events these patients in our study, how many events of progressive disease had they sustained in the 8 years prior to coming into our study? And they had these 49 events of worsening disease in the hands of expert cardiologists during this time period. However, once they came with us over the next 12 years, 17 of these 18 had no further events. Yes, we did have one little sheep who wandered from the flock after 6 years, got into the French fries, lamb chops, glazed donuts, more angina, had a bypass, and now is back with the flock. But he does, I share with you this, so he does exemplify the point that I'm trying to make. All right. Now, as happy and as proud as we were as some of these results from the early study, boy, did we get hammered. Dr. Esselstyn, that is a small study. Dr. Esselstyn, it was not randomized. Dr. Esselstyn, your diet is very severe and extreme. And what makes you think you could ever repeat a larger study with similar results? So we did. Our first study was in 1995. This one was in 2014, published in the Journal of Family Practice. And I think there's some key points that I wanted to make. And one is that the question was whether or not these patients would adhere. And sure enough, we found that the adherence rate was 89.3%. That's almost 90% who were adhering to our diet program over this close to 4 years of follow-up. And we've had any number of physicians who have visited our program, but they may occasionally call and say, Dr. Esselstyn, I'm just not having much luck in getting patients to follow this. And I said, well, why don't we talk a little bit how we do it? And maybe there'll be a few wrinkles or points that you can borrow that might help. Because if you're going to get somebody to make a lifestyle change, you are going to have to show them respect. And the only way that I know to show a patient respect is to give them my time. So in the present format that we're using now is that once a month I conduct an intensive counseling seminar with usually no more than 18 or 20 patients. And they're going to learn all about how they have created their disease and precisely how we are going to empower them as the locus of control to halt and to reverse their disease. Now, in addition, since I'm a little bit old-fashioned, 10 days before these patients are going to come to our seminar, which is a single day, 5.5 hours, my secretary will give me a list of these patients and their phone numbers, and I will call every one of them myself personally because I want to get my arms around their story. At the same time, provide them an opportunity to ask questions of me so that coming to the seminar, we have a strong platform from which we can all move forward. And I know of very few cardiologists who see their patients 5.5 hours, but you can just imagine how absolutely I am going to beat into their heads the absolute importance of the endothelial cell and nitric oxide. Because once you have a patient sitting there who's had a heart attack and they've listened for 5.5 hours, they now know the only reason they had their heart attack was their food had so destroyed their endothelial production of nitric oxide. They ran short of nitric oxide and couldn't prevent themselves from making these blockages in plaque. All right. Now, the other thing that was key, how did these patients do on this new study? Well, of those who were adherent, of the 177 out of 198 who were adherent, there was one gentleman in China totally misbehaving. He had a tendency to have high blood pressure anyway, eating all the salt off the street restaurants, and had a hypertensive episode and had a small cerebellar stroke from which he recovered. On the other hand, those 21 patients who were non-adherent, 62% in the follow-up period had a progression of their disease. All right. Now, I want to spend a moment. I've decided it was time to compare our results with some of the really better known cardiovascular results, which different institutions are fairly proud of. And let's make some sense out of this by looking at first the box on the right, which underneath it says Lyon. That's the Lyon Diet Heart Study. It's a Mediterranean diet study. And at the end of 4 years, 25% of those persons in the study had had heart attack, stroke, or death. We move to the box just to the left of that, the natural history of coronary artery disease. At the end of 4 years, this is a study out of Columbia Presbyterian Hospital in New York City, 20% heart attack, stroke, and death. To the left of that, Bill Bowden's Courage study. At the end of 4 years, 19.4% heart attack, stroke, and death. So collectively then, of those three, somewhere around 22, 23%. Then go to the left. There we are. 0.6%, one patient. That's over a 30-fold difference between these results. Why are our results so profoundly different? The answer is because we instruct the patient about the causation of the illness. Ever since the days of Hippocrates, there's been essentially a basic covenant of trust that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in cardiovascular medicine, that's not being done. So what do we see? Comparing this approach with the usual approach, there's no mortality from the diet. There's no morbidity from the diet. Obviously, when there are stents and bypasses, those procedures can cause morbidity and mortality. Now, the exciting thing is there's no additional expense and the benefits improve with time. And when you think about it, anybody who's had a heart attack is now petrified, walking around with the sword of Damocles hanging over their head. When do I get my next heart attack? When does the other shoe fall? Well, nonsense. You can make yourself heart attack proof. You can thicken and strengthen the cap over your plaque so it never ruptures, and you make yourself heart attack proof. All right. Now let's take a look at, on the left, you are looking at a pulse volume at the ankle, the strength of the pulse at the ankle in a 52-year-old gentleman who was coming to my office who had to stop 5 times crossing the skyway because of pain in his right calf because of a partially blocked artery in his right thigh. However, I was so focused on his heart, I totally forgot about his leg until 10 months into the study. One day he said to me, "Dr. Esselstyn, do you recall when I first started seeing you that I was stopping 5 times crossing the skyway to your office?" "Yeah." He said, "You know, in the last month, it stopped. The pain is gone." I said, "Well, Don, back you go to the vascular lab." And we repeated the pulse volume on the right. And it is now double. So we suddenly had, in 1986, within 15 months of starting our study, we now suddenly had absolutely irrefutable, rock solid, irrevocable science that food and food alone was capable of reversing cardiovascular disease. And somebody's going to say, "Well, wait a minute. What about the statin drugs?" Well, wait a minute. This is 1986. There were no statin drugs. So think about it. There are 2 examples that I've given you today of profound disease reversal with patients who'd had no statins. So that those patients who don't take statins or cannot take them, if they're willing to make these kinds of significant nutritional changes, can do absolutely just as well. Now, here happens to be another, and this is actually, this is a 78-year-old retired high school chemistry teacher. And in his retirement, he and his wife loved to enter square dance contests. But it was during the fast square dances that he was getting bilateral calf pain. And he saw some vascular surgeons who got the images you see here. And he did not like the big operation that they were describing he would have to have. And he came, he found us over the internet, came to see us. And during counseling, he said, "Dr. Esselstyn, if I choose your method, how long will it take me to get rid of this calf pain?" So I looked at him with great wisdom in my face and said, "Probably about 10 or 11 months if you stick with our method." 3 months later, I got a phone call. "Dr. Esselstyn, you do not speak the truth. The pain is gone." All right, now, I don't know what part of the world those of you who are in the audience are today, but in Cleveland, when you're on television and you're watching a mystery or you're watching a sporting event, just before the advertisement comes on, you will hear the mellifluous tones of the advertisers say something like, When the moment is right, will you be ready? Now, we all know that the penile artery is really quite tiny compared to the coronary artery to the heart. And not infrequently, before somebody comes down with heart disease, you may have the canary in the coal mine. They may find that they're no longer able to raise the flag. However, all is not lost. Not occasionally, I will get a phone call 10 or 11 months after I've counseled somebody. Dr. Esselstyn, yes, this is Mr. So-and-so. Sure enough. Yeah, Doc, I really thought I ought to give you a call because recently something has come up. And I'm wondering if I don't owe you another check. Now, I promised you before we would wrap this up that I wanted to try to explain how it is that the patients who have a plaque that is unresponsive, it's been there for decades, it's made up of fibrosis and scar and calcification. Well, let's look at the left, what we call here a PET scan. And the PET scan on the left, you can see where it is orange or where it is yellow. And that indicates there's a good blood supply there. But on the one on the left, you will see there's a patch on the right side of green. And the green indicates that that's poor blood supply. This was in a 60-year-old downtown Cleveland stockbroker with a cholesterol of 248. And it was at the time that he had that PET scan on the left that I counseled him. Then 3 weeks later, we brought him back and we repeated the same PET scan. 10 days after he had made his nutrition switch, his cholesterol had gone from 248 to 137. And there you are. How in the world does that happen? We haven't washed out or any blockage in just 3 weeks. What's going on here? Well, what you're seeing here is the heart without any muscle. And you can see that there are the three main coronary arteries, the right, the left anterior descending, and the circumflex. And those are the ones that you see now, they're initially are riding on the surface of the heart. Those are the ones that get all the publicity with stents and bypass and so forth. But look where they go. Every single one of those three major arteries, they all dive into the heart muscle to carry the oxygen and nutrients to the cardiac muscle. And you can see as they dive into the heart muscle, they branch into literally thousands and thousands of these small vessels. So it was about 6 or 8 years ago that I called to Rodriguez, who is the chairman of cardiovascular pathology at the Cleveland Clinic, who dissects approximately 200 hearts a year from the deceased. And I asked Rod, I said, can you share with me this? Once the artery has dived into the heart muscle, do you ever see good old standard garden variety blockages as we would see in the major coronary artery while they're on the surface of the heart? His answer, never. So now I really had an understanding of what we were seeing. Because think about it this way. When we first see these patients, they are so beaten down. Their poor endothelial cells are just absolutely been crushed. So they're making very little nitric oxide, which is the great blood vessel dilator. And believe it or not, your endothelial cells have now become your enemy. They are your enemy because they are making two molecules, endothelin and thromboxane. And endothelin and thromboxane are what we call vasoconstrictors. So think about it. When we see these patients initially, they're hardly making any nitric oxide, and they are making vasoconstrictors. So this enormous, entire intramuscular path of all these tiny branch vessels are all pinched. They're narrowed. They're even squished because of thromboxane and endothelin. So what happens is suddenly these patients start eating correctly. They no longer are injuring their endothelium. It starts to make more and more nitric oxide, a vasodilator. And most important of all, it stops constricting the thousands and thousands and thousands of bond vessels that you see that are intramuscular here. So when you open up that enormous pathway, then what happens is absolutely just what you saw here, from the left to the right. Now we have reperfusion within 3 weeks. And this is so beautifully correlates when you're talking with these patients and they say, Dr. Esselstyn, I don't know what's going on. I've had this angina for 2 years. Once I've switched my diet, within 6 or 8 weeks, it's markedly improved. Sometimes it's even gone away that soon. So pretty darn exciting to think about what's happening. So let's summarize the measures of cardiovascular disease reversal. I've shown you reversal on the angiogram. It reverses on the stress test. I've shown you reversal on the PET scan. Same thing, obviously, will reverse in the arteries to your brain from the carotid. We've talked about the pulse volume reversal and the reversal of the symptoms of angina, claudication, and erectile dysfunction. Well, you've been a very, very patient audience. I want to summarize before I answer some questions for you. For those of you who haven't been to Cleveland, I worked for many years on the 8th floor of this A building as a surgeon, but I really want those of you in New York and surroundings to know what the trees look like in Cleveland in February. However, actually, when I retired from surgery, I was hired by the Wellness Institute. Now, the Wellness Institute, the budget is more modest, but the morale is really quite high. And one thing I've learned since 60 years of being away from medical school, yes, brains are important. However, nothing is as important as persistence. Persistence best exemplified by this young damsel in Life magazine, 1939, trying to learn how to do the splits. And it's tough to do the splits, but she stuck with it. Sure enough, the other day, I guess it was in downtown Melville that it was Steve Shore who spotted her. And she had got it right. So at this point, if it's in the plans for Steve, I'd be happy to try to answer some questions.
Thank you so much, Dr. Esselstyn. Just phenomenal for all of us. This is Ben from The Real Truth About Health again. And want to go ahead and just make sure everybody knows how to play the Q&A game that we have here. So I'm just going to tell everybody now, and I see a bunch of raised hands already. What we're going to do is, have everybody raise their hands. The way you do that, in case you don't know, you click on your reactions tab on your Zoom controls, and you'll see a little emoji there that says raise hand. You can click that. We will take everybody's questions that we possibly can in the amount of time we have, and we'll take them in order. We see the raised hands come in the order in which they were raised. You can see Dr. Esselstyn's contact information there on the screen, dresselstyn.com. And with that said, we have a lot of questions coming in. And so we're going to ask everybody, please keep your questions very brief, very direct for Dr. Esselstyn. And please only ask one question, because we want to be compassionate for everybody else that has a question as well. We're going to get to as many as we can. And with that, Doctor, by the way, for some people, you might not have a reactions tab. If you don't, you can click on your participants tab, and that'll give you your raise hand function. So Dr. Esselstyn, thank you again for being so gracious. And if it's okay with you, we'll get started.
Yes, good.
Excellent. Thank you. Okay. So that said, our first question, our tech team will go ahead and invite you to unmute. It's Sin. Sin, if you go ahead now. Thank you.
Hello, Dr. Esselstyn. Thank you so much. I really enjoyed your lecture so much. Can you please tell me what blood tests and supplements are needed with the dose and frequency when following a whole food plant-based diet?
I guess I'm a little bit old-fashioned in that the literature that I read, as recently as this the last several months, it's very, very problematic to start loading up on supplements when, if you are eating all the vital nutrients in a whole food plant-based nutrition, you're going to get your vitamins and nutrients from food. Although I do suggest that our patients get B12.
Thanks, Dr. Esselstyn. And up next, we have Margie. Margie, if you can go ahead with your question by unmuting.
Hi, Dr. Esselstyn. Thank you so much for taking my call. I'm on a no oil, whole food, plant-based diet. I have done your protocol for the nitric oxide 6 times a day, and according to my test strips, it is perfect. It works. However, my homocysteine is 14. Should I be concerned?
No, I think if you're eating and you're getting all the B12 and folic, you're doing what you can. And I'd be a little patient with the homocysteine, because it's hard for me to know how anybody who is eating as carefully as you are and is not going to be injuring their endothelium and is getting plenty of nitric oxide, I'd be a little cautious about your homocysteine. I wouldn't worry too much, but keep an eye on it. Maybe check it a couple times a year.
Thanks, Doctor. Up next, we have Sophia. Sophia, what's your question for Dr. Esselstyn?
Yes, please. Besides being on a plant-based diet, what are your recommendations to help optimize heart function during menopause? Unfortunately, I'm allergic to soy, which could have helped me. So are there any natural hormonal supplements? And I think that can help. Thank you.
Yeah, you make an interesting point. It's interesting that if you carefully look at the nation of Japan, the Japanese hardly even have a word for hot flash. And it appears that when we're eating the Western diet and our estrogen and other things become quite high during most of our lifetime, then when you go through a menopause, a change of life, the descent of the amount of estrogen is so large and so precipitous that it seems to precipitate these hot flashes. I would simply try to stick with whole food plant-based nutrition, and sometimes there are you can talk with your gynecologist. There can be some modest types of estrogen that can ride you through this period. But I really think that sticking with whole food plant-based nutrition, especially in the decade or so before starting to have a change of life, would be benefit.
Thanks, Dr. Esselstyn. Up next, we have Yaron. Yaron, if you'd go ahead with your question.
Yes, so I would like to ask you, doctor, what type of affordable test like CAT scan you would recommend in order to check if a person have a blocked arteries?
Yeah, you want to be safe about this. You can start off and you could either have a CT angiogram if there's a concern, because it's relatively safe, because you're not going to have a catheter going up into your heart. They're just going to be injecting some contrast into a vein in your arm, and then they'll time it so that when they take the x-ray, the dye or the contrast will be going through the arteries to your heart, and they can get an idea of what's going on. But if you're without much in the way of symptoms, and you probably could avoid many of these studies just like if you're willing to stick with whole food plant-based nutrition. Yeah.
Thanks, Dr. Esselstyn. And up next, we have DF. DF, if you'd go ahead with your question.
Hi, Dr. Esselstyn. Thank you for everything you do for heart patients. I just wanted to clarify, maybe you can clarify for me, you said that eat a fistful of high nitrate veggies 6 times a day. I think you meant, I just want to understand that it's every time is a fistful, not like one fistful spread throughout the day. Thank you.
A fistful may be a little much, maybe a half a fistful or something like that. But also, I don't know, I couldn't tell from your voice, of course, whether or not you said that you would have any cardiovascular issues. But if you don't have any heart disease, you're still going to get plenty of green leafy vegetables if you do this 2 or 3 times a day. But it's just for the patients that in my practice, once they have a diagnosis of a cardiovascular disease, and I know they are depleted in nitric oxide, then I ask them to go to the 6 times a day.
Thanks, doctor. Up next, we have NW. NW, if you'd go ahead.
Hi, doctor. My question is, when you speak of mouthwash destroying nitric oxide production, does that include if you used a hydrogen peroxide mouth rinse, or are you referring to only alcohol-based mouthwashes? And secondly, would tongue scraping from mouth hygiene, would that affect anything?
Yeah, those are all good questions. I'm not sure I can tell you the answer between I'm just a little bit wary about it. Because hydrogen peroxide is pretty strong in its own right. I mean, it's effective for what you're doing to help clean those bacteria. But I would be a little bit cautious. If you want to see, what you want to do is cradle and cuddle and be kind to those bacteria that are in your tongue that are going to be responsible for reducing the nitrate to a nitrite, which is also why I have some reservation about scraping your tongue.
Thanks, Dr. Esselstyn. And up next, we have, excuse me, Janet is up next for you. Hi, Janet, are you there? Oh, there we go.
Yes. Okay. Yes. Hi, Dr. Esselstyn. First of all, thank you so much for all your phenomenal work with heart patients. We love you and love your work, and thank you so much. I was just curious about the 6 greens a day. Rather than 6 greens a day, can one have 3 greens a day, double portions instead of 6 times a day?
Well, again, I have to reemphasize that the 6 a day is for patients who have a diagnosis of cardiovascular disease. And now, the reason that I've retreated from somebody who's saying, well, why don't I just have a big salad at night? No, remember, what I'm after here is I'm after restoration of your nitric oxide. So if you do this repeatedly at breakfast, mid-morning, lunchtime, mid-afternoon, dinner time, and evening, what you are doing is you are all day long, you are trying to expose yourself and saturating yourself with this magic molecule of nitric oxide that is so important. Hope that helps.
There it is. Thank you, doctor. And up next, we have Alexandra. Looking forward to your question.
Yes, hello. Thank you very much. I will read your book. I just ordered it via Amazon. And before I have been on raw food mostly, but not totally. And I wanted to know if your protocol would also help people with, not with, I'm from Germany, my English is not so good, with arterias who are clogged, but who have chronic heart insufficiency due to chronic fatigue syndrome, ME, because I can barely move and so on. Would you say it also helps, or is it mostly for the arterias who are blocked? I think mine are pretty clear, but my heart seems to be very weak.
You know, with all due respect, I'm not sure that I'm fully understanding your question, and maybe our moderator would be willing to repeat the question.
Alexandra, just tell us one more time, if you can, briefly, specifically what the question is.
Yeah. Having from chronic fatigue syndrome, suffering a weak heart, but clean arterias, would your protocol help?
Okay. So the question is, you've got chronic fatigue, but they've done studies of your heart that shows that the blood supply to your heart is fine. And that is a part of your chronic fatigue. I'm not quite sure yet that I've heard how they measured that your heart was weak. Does that mean that it's the left ventricular ejection fraction is low?
We've actually, she's here. Okay,
not
good.
so far. I told my symptoms, and then the doctor just said, well, yeah, that's because of your chronic fatigue syndrome, and that was it. I didn't receive, I only received ultrasonic of the arterias, which looked great, and that was it. So.
Well, I'm not, yeah, I rarely ever have questions in my practice about chronic fatigue. So I really would have to, in fairness, have you somebody who perhaps has an interest in that. But on the other hand, I can see absolutely no downside to your aggressively trying to eat, as we've discussed, with green leafy vegetables. I don't know that anybody would be against your eating the healthiest diet on the planet.
Thanks, Dr. Esselstyn. And next we have Pamela. Hi, Pamela. Oh, we saw you on mute for a second, but I think you went back on. If you can click that one more time, Pamela. Pamela? There we go.
Thank you. I'm here. Thank you. For your patients with cardiovascular disease, taking 6 times a day the greens, for how long must they do that? The rest of their lives? Or how do you measure when things are improved?
Well, no, I think you bring up an excellent point. But usually when patients begin, their symptoms begin to resolve, and if they have a measurement that their disease is reversing, really, I think easily within a year or two, they could drop down to 3 or 4 times a day.
Thanks, Doctor. Up next, we have Lynn. Lynn, if you'd go ahead with your question, please.
Hi, thanks for all you do. I had a question in regards to fluoride toothpaste. If you don't recommend using that kind of toothpaste, what should we be using? And the second part of this is, I have very bad dry mouth because of medicine that I'm on. So my dentist also has me using a special toothpaste at night with fluoride in it. And I wear these mouth guards that I put some other fluoride stuff in it at night. So I'm kind of being, fluoridated to death here. So my question is, what should I be using if you don't recommend fluoride?
Well, I don't want to get in a wrestling match with your dentist, but you've asked the question is, are there toothpastes that do not have fluoride? And the answer is yes. I don't think I ought to be in a position of commercially pushing somebody's brand over another, but I would simply suggest that you go to Amazon, and as you look up toothpaste and look up those without fluoride, you'll find a number of brands, and I guess you can just choose the one that you like that tastes correctly for you. I can't help you with these other dental obligations of products that contain fluoride, but I think just if the other situation begins to resolve and you can get rid of those fluoride products, then it probably it'll work better for you. Because as you probably know, I'm doing whatever we can to help people who are deficient in nitric oxide to find a safe way to gain it.
Thanks, Doctor. Up next, we have Francis. If you'd go ahead and unmute yourself, please.
Hi, Doctor. Thank you for all your great information. I have some questions about the mechanics of the chewing the vegetables. You said to just sprinkle a drop or two on the vegetables of the vinegar. Can you use more? Is there a problem?
Yeah, several drops. I wouldn't flood it with it, no. But I mean several drops, because as you remember, the reason for this is the acetic acid from those vinegars has shown to restore the nitric oxide synthase enzyme that is contained within the endothelial cell and responsible for making nitric oxide.
Thanks, Dr. Esselstyn. Up next, we have Stephanie. Hi, Stephanie. Looking forward to your question.
Hello, Dr. Esselstyn. Thank you for the awesome presentation. So for heart patients, would you, how do you feel about calcium channel blockers, beta blockers, and salt? Should all be avoided or weaned off of?
Well, I'm not a great fan of medications, because when you think about it, none of the medications have anything to do whatsoever with the causation of the heart disease. However, there may be some other indications that are appropriate, but when you are eating whole food plant-based nutrition, and if your left ventricular ejection fraction of your heart is in the normal range, and other things being equal, I try to be your own advocate and ask your doctor precisely why it is that you're taking that medication, and see if you can't sort of, work together to see if you can't either cut the medications in half if you don't like the side effects, or maybe even reduce them and eliminate them and see how you do without them. But also be sure you're eating whole food plant-based nutrition to optimize the function of your heart. Yeah.
Thanks, doctor. Up next we have, and I hope I'm pronouncing this correctly, Vijaya?
Yes. Hello.
Hi, welcome. We can hear you.
Yes, thank you very much. Doctor, this question regarding my husband. He is a diabetic, 62, and all his functions like liver, kidney, thyroid functions are normal. HDL is in 56, vitamin D is also 66. So I would like to know, he has a high lipoprotein that is 200 last year, and this year it is 230. So how he can reduce that, and does that mean he has a heart disease? Thank you.
Well, let me see if I've understood the question. Yeah, I'm not sure I heard what your husband weighs. What his weight is?
If you can go ahead and unmute yourself one more time, let us know what your husband's weight is.
He weighs 180 pounds and 5'9" tall.
Right. Yeah, he could probably lose about 10 pounds, but again, for I think most of the diabetic parameters are going to come into line when he's eating plant-based nutrition. Maybe I think he could lose another 10 pounds, maybe 15, and that would really begin to further, I think, make his numbers be a little bit more optimal. As far as an LDL cholesterol of 230, you'd like to really see a diarrhea, because I didn't hear whether your husband was eating whole food plant-based nutrition and still having an LDL cholesterol of 230. That's really rather unusual. And what I usually do with these patients is I carefully go over a diary first, see how many times they are eating out at restaurants and so forth, and then see if we can't really tie down all the loose ends. Then, if everything else being equal, you may want to think about trying a statin medication. Another thing that seems to help to lower that cholesterol is maybe several teaspoons of several tablespoons of flaxseed meal, and also the gooseberry powder, that is amla, AMLA, amla powder.
Thanks very much, doctor. Also, before we take the next question, seems like we lost a little bit of your volume. I don't know if you can turn it up or if you just want to lean forward a little bit when you answer. It's very helpful when you do that.
Okay, happy.
We appreciate that. Thank you so much. And up next, we have Benny F. If you go ahead and unmute yourself, please.
Thank you. Thank you, Dr. Esselstyn. Your methods have been studied and proven for years. Do you have information about the benefits of whole food plant-based being taught more in medical schools and accepted by your fellow docs?
That's going to take a while. But I can tell you that really the scene is so different now than it was 34 years ago. And there are just occasional cracks in the wall. You see, there is so much competition for the medical students' time that it's almost like a faculty fight to get some additional hours of the medical students' time to teach them nutrition. But it is absolutely so powerful. It has got to be a requisite, and we just have to be totally unrelenting in getting them this education. If we can't get it to them in their medical school years, then in their postgraduate years, it's vital. But I certainly hear your point, And we're really doing everything we can to make that happen.
Thank you, Doctor. Up next, we have Ursula. If you go ahead with your question, please.
Hey, Dr. Esselstyn, I'm really honored to ask my question. You're a legend. My mom has 11 stents, and I started studying nutrition because of that. And the thing is, they teach us in class that according to Advanced Health Study 2, there's only a positive effect for lowering mortality from ischemic heart disease, sorry, I'm German, for male vegans, ovo-lacto-vegetarians, and pescatarians. So does that mean women shouldn't be vegan?
No, I totally 100%. No, we've shown that women respond the same way, in a very positive way, when they're eating plant-based nutrition. I would have to respectfully say that I really feel that the data are absolutely rock solid of the benefits for both sexes for this.
Thanks, Dr. Esselstyn. And up next, we have Mark G. Mark, if you go ahead with your question, please. And okay, there we go.
Yes. With your protocol, how does it relate to heart murmur and valve regurgitation?
Yeah, it would be unfair of me to tell you that the nutrients in plant-based foods are going to change a mechanical problem. Often, with what's going on in the valve is a mechanical problem, and that either can somehow be often repaired by a catheter technique, or it may require open heart surgery. Or other times, there may be murmurs that the heart is presenting that really are not significant. There can be a murmur related to a valve, and it does not reflect an injurious valve. So all that you hear may not be evil.
Thanks, Doctor. Up next, we have James. James, we're looking forward to hearing your question for Dr. Esselstyn.
Yeah, doctor, thank you so much. What a wonderful treasure you are. You should be made the Surgeon General. We'd save hundreds of thousands of lives. You're amazing. You've done such great work with heart disease. Could you just have your opinion on blood cancers, non-Hodgkin lymphoma, any studies or anything? If you could maybe start working on that, doc, and save some more of our lives, that'd be great. Would you have any thoughts about that?
Well, you've caught me. You branched off of my area of specialty, but for patients who do have Hodgkin's disease or non-Hodgkin's lymphoma, fortunately today, in some of the chemotherapeutic applications have really drawn some wonderful results. But it would be, I think, totally unfair of me to tell you that I have expertise in non-Hodgkin's lymphoma.
Thanks, Dr. Esselstyn. Up next, we have Barb. Barb, if you'd go ahead with your question, please. Hi, Barb. Barb, I see you're unmuted, but I don't hear you. Are you there? I tell you what, Barb, if you can, try to get that fixed for the next round, and we're going to go to Carrie F now. Carrie, if you'd go ahead with your question.
Hi there. Thank you so much, Dr. Esselstyn. It's just so special to listen to your conversation. My father died of heart disease at age 64, and I wish we could have had this information. It would have saved his life. But my question, so thank you so much for your contribution to the world. I'm wondering your opinion about fish oil, omega supplements to reduce inflammation.
Yeah, it's interesting. If you try to follow the literature on the omega-3, you kind of have these ups and downs. I think the jury is still a little bit out, but just last week I read 3 studies that showed with omega-3 that there was no benefit. And one has to be a little bit cautious about buying these fish oil deals that just come out through a drugstore, because you're going to get, unfortunately, PCBs, dioxin, and mercury are all these contaminants in fish. If you need to get omega-3, I would get omega-3 algae. which does not have any fish oil in it.
Thanks, doctor. Up next, we have Melina. If you'd go ahead and unmute yourself, please, for Dr. Esselstyn.
Hi, doctor. I was so good to hear all this information. You were too specific and too plain about all this. I'm calling from Europe, so it's good to see you here. My question is this: if someone has a problem with blood pressure, with platelets and blood disorders, what do you not recommend for him to eat?
What do I recommend people to eat who have a platelet disorder? Whole food, plant-based nutrition.
There it is. Thank you so much for that, doctor. And up next, we have Liesel, if you'd go ahead with your question.
Hi, Dr. Esselstyn. Thank you very much for your lecture. It was amazing. My question is on the lecithin and carnitine. If it's from a plant-based source, is it fine to use or should it still be avoided?
I'm going to need the moderator to repeat the question.
Yeah, Liesel, that was a little foggy. If you could just repeat that slowly one more time. I know it was about carnitine, but if you could just go one more time.
Sorry, the lecithin and carnitine, if it's from a plant-based source, so not animal, can you use it or should it still be avoided?
No, we want to, if I understand the question correctly, yes, we want to avoid lecithin and carnitine. Those are the molecules that contain in the animal products that when they are metabolized by bacteria in the microbiome of an omnivore, that's when you create TMAO, and TMAO is the molecule that injures blood vessels.
Thanks for clarifying, doctor. And up next, we have Nancy. Nancy, we're looking forward to your question for Dr. Caldwell Esselstyn.
Yes, hi. Thank you, Dr. Esselstyn, for your talk. I have a question about your slide on the birth of a plaque. For the atherosclerotic plaque, I mean, does that depend on the origin, where the plaque originates, the size, and the number of plaques? In other words, is there stages of plaques that goes on into the heart? And see, my doctor says that I need to take a statin to help with my cholesterol, the good cholesterol, but also the fact that I have atherosclerosis. But I feel that does the origin of the plaque affects whether you have the atherosclerosis? I mean, if the plaque is situated outside the artery, is that less serious than the plaque situated within the artery? And what is the best way to reverse it besides the whole food plant-based method?
I think that I'm going to be sure I understand the question. The question is, how does the plaque form? And the plaque doesn't form outside the artery. The plaque forms inside the artery. And as the plaque grows, it diminishes the diameter of the artery, and it tends to block the artery. Now, how does that start? The whole process seems to start when you eat food that is going to injure your endothelial lining of the artery. And I went through all those foods very carefully with you in our presentation. And by avoiding the foods that injure the endothelium, and it comes back strong enough with plenty of nitric oxide, then what happens is you begin to see the process of reversal will occur. And the best way that I know to do that is with whole food plant-based nutrition. you can talk with your doctor if you want to take a statin, but I think I showed you today that some of our most profound reversals of disease occurred in those patients where statins either were not available or they had been refused.
Thanks, doctor. Up next, we have DF. DF, if you can go ahead with your question. Thank you.
Thank you, Dr. Esselstyn. Since HDL is no longer found to be a good biomarker for heart health, should we be concerned that someone eating a balanced whole food plant-based diet having a reduced or declining HDL? Thank you.
Yeah, that's an excellent question. Yeah, we noticed in our, but first of all, let's take for example, the lower limit of normal of HDL for men is 40, all right? We noticed back in 1986, 87 with our first group of men, they all suddenly, within starting our program, they had dropped their HDL cholesterol into the mid-30s, all of them below the accepted normal level of HDL. And at the same time, they were losing weight. At the same time, their symptoms were disappearing. And when we carefully studied them, they were reversing their disease. And there's been a considerable amount of research since then that clearly shows that when someone is eating whole food plant-based nutrition, which is such an anti-inflammatory diet, your liver recognizes this, that your body has so much less inflammation that it is now decreasing the amount of HDL cholesterol that it produces because there's no need for it. As a matter of fact, remember I just said the lower limit was 40. Guess what? The Tarahumara Indians in northern Mexico, when you measure their HDL cholesterol level, 25, which would drive the unknowing cardiologist absolutely apoplectic. But why? Because their inflammation is so low in their bodies. They eat the three sisters: beans, corn, and squash. No nutritional deficiencies.
Thanks, doctor. We have just a couple of minutes left. Let's move over to Elise now. Elise, it's either Elise or Mark, or Elise and Mark. Hi.
Hi, thank you so much, Dr. Esselstyn, for all you do. My husband and I went plant-based 3 years ago. My doctor did my cholesterol, and my cholesterol dropped from 225 to 170. Every 6 months he takes it, and since then it's gone back up to 220. I eat no oil, but I do eat chia seed, flaxseed, hemp seed, and a Brazil nut. Is there anything you could recommend? Because he started me on very low dose pravastatin, and even that didn't work. So I'm staying at 220. Is my body just making it, and I should stay on the statin or stop it?
Well, I would want you to work with your doctor. I think that the one thing that you haven't perhaps tried is that sometimes will help lowering cholesterol is the you heard me mention this before, is the amla powder. That's A-M like in mother, L-A, amla powder. It's from gooseberries. That seems to help lower cholesterol and lower triglycerides.
Doctor, thank you very much. Up next, we have Mark. Mark, if you'd go ahead with your question.
Yes, thank you for your lecture. If one was 65 years old and had an ejection fraction of 35, but no apparent arterial disease, do you have any additional suggestions for increasing EF without incorporating drugs?
Yeah. You have to, I think the first thing that has to happen is somebody has got to have an absolutely rock solid diagnosis of what is causing this heart failure. Is it hypertension? Is it valve disease? Is it some, perhaps even some medication that may be creating this? Because really the only way to have a successful, accurate treatment is, first of all, have to have a rock solid diagnosis of what is the causation of the heart failure, which is obviously not apparently from any vascular disease. Good question.
Thank you so much, Doctor. Let's go now to Dave. Dave, if you'd go ahead with your question, please.
Hi, Dr. Esselstyn. Again, thank you for everything that you do. Been on a plant-based diet 100% for the last 3 years. Quick question for you. I drink a daily cup of coffee, and I know in the past you've mentioned that it's not the best for your endothelium, but wanted to get your opinion. If I just have 1 cup of black coffee a day, does that affect me health-wise in the long run?
Well, I don't like things that injure endothelium. I'll give you the background of the study. What swayed me on this was that there was an Italian study where they divided the 2 groups of healthy young volunteers. One group was drinking coffee with caffeine, the other was drinking coffee that was decaf. And after they drank the coffee, they had the brachioradiatronica test, which is a test for production of nitric oxide. Then they would switch groups. The groups that the former was having coffee without caffeine was now having coffee with caffeine. It was always the group that was having coffee with caffeine that diminished their endothelial output of nitric oxide. That's what swayed me.
Thanks very, very much, Dr. Esselstyn. And with that, we're going to bring this Q&A to a close. We're sorry we're not able to get to everybody's questions. Quite frankly, those were the biggest amount of questions we've had for anybody yet. And so it's hard to get to everybody. Everybody, you can see Dr. Esselstyn's contact info there, dresselstyn.com, best place to get him. And what can we say? You're so generous and gracious with your time and your phenomenal presentation as always. And thank you for doing all this Q&A with everybody. It's truly a privilege for us to have this sort of intimate time with you. And we thank you so much for that. I want to remind everybody that at 2 p.m. Eastern time, we're going to be right back here in just about a half hour with one of Dr. Esselstyn's colleagues, Dr. Michael Greger. So make sure you come back for that. But in the meantime, Dr. Esselstyn, we just want to thank you. You've been back several times now. We so appreciate that here at the conference. But I'm not the only one that wants to thank you. I'm going to have our tech team open it up to everybody. What do you want to say, everybody?
Thank you, Dr.
Thank you so much.
You're a blessing.
Thank you for being great job.